Good morning, everyone. My name is Bryant Chorn. I'm one of the community engagement supervisors here with the Orange County Social Services Agency. And today I will be doing a presentation on the SSA programs that we have offered, which is going to be Medi-Cal, CalFresh, CalWorks, and in-home supportive services. Also, if you did need translation in Spanish, we actually do have that offered today. You would just need to hit the More icon and go to the globe translation and select Spanish if you need Spanish translation. And to get started, I will be going with Medi-Cal. I will also be going over the program updates as well affected by the HR1 bill, also known as the Big Beautiful Bill. So to start off with, we are going to be discussing Medi-Cal. If you guys are unfamiliar with Medi-Cal, it's essentially low cost or no cost health insurance for individuals who have zero or low income within their family household. And to start off with, uh, for this program, you actually can apply anytime all year round. You don't have to wait for an open window period. Normally, if you do work at a job and they do offer health insurance, normally you would have to sign up for their health insurance program around September. But with the benefit of Medi-Cal, you can actually apply anytime whenever you need health insurance. And some eligibility factors for the Medi-Cal program is you must be a California resident and all of our income or programs are going to be income based. So we are going to ask for your pay stubs or however income you do receive it and tax filing status. The reason why we ask for tax filing status is because that's how we are going to determine your Medi-Cal case. So let's say, for example, it would be me and my significant other. We file our taxes and we also have a child, so we would claim them on our taxes. That would be a Medi-Cal case of three. But let's say, for example, me and my significant other are divorced and we are filing our taxes separately. If my wife were to claim our child, that means her case would be a case of two, and I would just claim myself. So that means my case would be a case of one. And if you were to apply for Medi-Cal and you were to be approved, this is the card that you would be receiving from the state. So currently right now we are distributing the card on the left, which is the poppy seed flower card. But if you did have Medi-Cal in the past, you probably received the one on the right, the blue and white one. But whichever card that you have, we will accept both regardless. Because if you look on the image where it says ID number, that is going to be following you essentially for the rest of your life because that's going to determine and identify you as having that Medi-Cal benefit. And it's also known as the Benefits Identification Card, also known as BIC. So you would be receiving that in the mail from Sacramento. It roughly takes about 30 to 90 days to receive that if and when you do get approved for Medi-Cal. And what are the benefits of Medi-Cal? Well, you currently can have all these benefits. So if you need to have your regular doctor's visits, if you need mental health services, we also cover dental and vision. Another benefit with the Medi-Cal program is we also offer in-home supportive services, where I will be discussing that later. But essentially, that's for individuals who have a physical or mental disability or who are over the age of 65 and they need medical care in order to stay in their home. We also cover prescription drugs if you do need medication and lab services. Uh, I will be going over this in the next few slides, but currently now, if you look at the three light blue colored services, the emergency services, hospitalization, and the pregnancy services, with those, due to the effects of the HR1 bill, that's called restricted scope Medi-Cal. So essentially, right now, if you applied prior to January 1st and you did not have satisfactory immigration status, meaning that you are either not a U.S. citizen or don't have a lawful permanent resident status, you would essentially only be eligible to these three programs or these services, the emergency services, the hospitalization, or the pregnancy services. But I will be going over that in the next few slides, but that's just a reminder. And once you do get approved for Medi-Cal, you filled out all the paperwork, we determine, hey, you're eligible for Medi-Cal. You would now need to select your managed healthcare provider. And the two that we have offered is Cal Optima Health and Kaiser Permanente. 90% of the time, individuals do get approved or select Cal Optima, but there are some that already have Kaiser, so it's more easier for them to get enrolled with Kaiser rather than Cal Optima. So you would actually get a thick packet in the mail, and that's how you determine who your medical care provider is going to be. And make sure that you do complete that packet on time, or we're just automatically going to select a managed care provider on your behalf. Um, I would like to make note that uh, our agency, Orange County Social Services Agencies, we only determine if you are eligible for Medi-Cal. We don't administer the health benefits. If you do have questions about where to assign your doctor, or if you need like medical assistance and you need like some sort of guidance, you would need to contact Cal Optima or Kaiser Permanente directly, because we only administer the benefit, meaning we only determine if you are uh, approved or not. And during the time of you selecting your managed care provider, since it is going to be taking about 30 to 90 days to officially get approved and get your benefits identification card from the mail from Sacramento. Um, don't think that you still can't get medical services. You actually can. And that's what is also known as straight Medi-Cal. And that is that window where you don't have a managed healthcare provider. And you can essentially go to any doctor that you want during that window, as so long as they accept Medi-Cal, and you won't need to pay anything. They'll essentially just get billed. The doctor will get billed and it'll get sent to Medi-Cal and we'll pay for it. So just don't think that you don't have any medical services during that time while you're waiting. You can basically go to any medical provider to get services. Now I will be talking about the Medi-Cal program updates that were affected as of this year. So the first one that happened was January 1st, where we reinstated asset limits. And this is more targeted towards our older population or individuals with disabilities. Essentially, what asset limits is if an individual has another household or a secondary vehicle, we would also count those assets, and that can potentially affect them being eligible for Medi-Cal. And so for asset limits, we excuse the first home and your first car. So long as you don't have like a second home or vehicle, that should be okay. But we also do count bank accounts as well. So we'll pretty much count all that to make sure that you're still going to be eligible for Medi-Cal. Next is the eligibility for full scope Medi-Cal. So prior to January 1st, we were heavily pushing individuals to apply for Medi-Cal before the January 1st deadline, because if individuals were to apply for Medi-Cal and they were approved, they would essentially be grandfathered in to receive full scope Medi-Cal. So if you remember this slide here, let's say, for example, I applied January 31st and I got approved and I don't have satisfactory immigration status, meaning like I'm undocumented or like I'm a asylum refugee, and I applied and I was approved. I am still eligible to all of these services. Like I can still go to my regular doctor's visits. I can also get my dental services and I can still get my prescription drugs. However, for those individuals now that are applying after January 1st and they don't have satisfactory immigration status, they'll only be eligible to these three: emergency services, pregnancy services, and hospitalizations. Again, that's also known as restricted scope Medi-Cal. And also, we're making sure for those individuals who don't have satisfactory immigration status, they continue to complete their annual renewals. So if you're approved from Medi-Cal, every year we'll send you a big packet called your annual recertification, meaning Uh, you still meet the income requirements. Nothing has changed in regards to like income or your family household size. And if you complete that, you'll still continue to get full scope Medi-Cal. However, if you do not complete that, um, and you get dropped from Medi-Cal and you need to reapply for Medi-Cal, you'll only get that restricted scope Medi-Cal. So regardless, if after you were applying December 31st and you were approved, but you got dropped and you want to apply again, you'll only be eligible to those three restricted emergency services. So make sure to be on top of that. You can also create a benefits cal account to make sure that you're on top of everything because it'll actually show you if it'll show you your due date of your annual renewal. So if you are unfamiliar with that, I also have another slide later in the presentation on how to create an account for that. And effective July 1st, dental benefits will be eliminated for adults 19 plus without satisfactory immigration status. So for those individuals who don't have satisfactory immigration status, meaning if you're an undocumented, you don't have lawful permanent residence, if you're a refugee asylee, you will not be eligible to those dental benefits. So if you do need to seek dental services, make sure you do it before July 1st. And effective October 1st, specific groups of non-citizens will lose their qualified non-citizen status. And for that specific group, it would be the refugee asylees, victims against women's abuse, VAWA. That's also what it's known as. But yeah, that specific group will lose their qualified non-citizen status. And that is going to be affected like later in like 2027, 2028. So this change, we're still pending to see with that group uh, if they're going to have to be paying like a premium in the future to continue keeping full scope Medi-Cal. We're still unsure. We're waiting for the state to give us the regulations and rules for the 2027 and 2028 year. However, this is what we know for sure for 2026 for Medi-Cal. Um, I will be holding a Q&A section after the presentation. So if you guys do have questions, you can type them in the chat. And then once we get to that Q&A section, uh, I can answer those questions as well. But next, our program, we will be discussing the CalFresh program. So for this program, this is essentially money to purchase food. I'm sure everyone's heard of like SNAP or like EBT. For California, we call it CalFresh. And again, this is a monthly allowance for food for individuals who are either low income or no income. And the way the money gets transferred, it gets transferred to this card on the right over here, also known as the EBT card. It essentially works similar to like the debit card. So if you were to go to the supermarket or a grocery store, you would essentially put all your items on the conveyor belt. And once the cashier rings everything up and tells you your total, you would just swipe the card. And for those items that are non-food related, like your cups or utensils, it'll automatically subtract the total from the card, and then you'll just have to pay the remaining balance with cash or however you pay your essential needs. And to qualify for this program, you must be a resident of Orange County, be a U.S. citizen or an eligible non-citizen like a refugee or asylee, and you must meet, excuse me, the income minimum requirements because again, all of our programs are income-based, so we are going to be asking for your income. And if you meet all those requirements, great. If you're a household of one, you could potentially be receiving a total of $298 per month for CalFresh. The reason why I say potentially is because everyone's circumstances are different because we do take in your expenses into account, your family size. So if you do know of an individual who's kind of in the same similar circumstances as you and is potentially receiving more CalFresh than you, um, it's because we do take everything into account, and that's how we come up with how much you would be allotted for the month. But again, you could be potentially receiving $298 per month. And a lot of people ask, um, I don't have satisfactory immigration status as a parent, but my child does. You can still apply for the CalFresh program. It's just only your children will be receiving the cash benefit because since they are a U.S. citizen, um, they would be receiving it. But for the parent who doesn't have satisfactory immigration status, they will not be receiving cash aid. But since they are the responsible adult, they would be using the card on behalf of the child to make sure that the child is getting food. And what can be purchased with the EBT card? Well, you can purchase fruits, vegetables, meats, dairy products, frozen food, and snacks. You can also even grow your own food to purchase, like seeds or plants, if you like to grow your own food. But what can't be purchased are hot foods, alcoholic beverages, vitamins and medicines, pet food, and non-food related items. I know on that first line where it says what can't be purchased is hot foods. There's actually a program within CalFresh called the Hot Meals Program, where if you are either a homeless individual or if you are unable to like cook or purchase your own meals, like if you're like an elderly person or like a disabled person and you need assistance with cooking your food, you can actually sign up for what is called the Hot Meals Program, meaning you can actually go to like uh, an approved restaurant, or you can purchase the hot foods at the grocery store. If you've seen like fast food restaurants like Subway or like Jack in the Box, where they have the sign that says EBT accepted, you can actually purchase your food using the EBT card. It's just a simple check of a box when the eligibility worker does your interview. They'll ask you, are you able to cook for yourself, or do you have any struggles preparing your own meals? If you say yes, or if you're homeless, they'll just check that box and you'll automatically be enrolled for the Hot Meals program. Now, this is an important slide because these are the actual income limits for the year, effective October 1st, and they go through September 30th. These numbers change every year, every October 1st. So if you applied last year and you said, hey, I don't think I'm eligible for this year, you may want to try again because the rates always do change yearly. And to determine a household size, it's how you purchase and prepare your meals. So let's say I live with a roommate and he's vegetarian and he cooks and purchases his meals separately. Um, that means I would just be applying myself. So I would be a household of one. But let's say, for example, my roommate loves my cooking. Let's say I'm a professional chef. I know how to count macros and all that stuff. And he wants me to purchase foods on his behalf because he likes my cooking and it's more healthier. That means if I apply, I would need to get his pay stubs, his income, and that would be a household of two. And again, the more people on your case, the higher chance you could be receiving more CalFresh allotment on a monthly basis. But again, that increases the chances of you potentially not being eligible because maybe your roommate might be making more than you. So just be aware of that. And these are the CalFresh program updates that were taking effect this year. These are the ones that have confirmed for the 2026 year. So there's actually going to be a new work requirement for the CalFresh program. It was previously implemented in the past. It stopped, but now we are bringing it back effective June 1st. So for those individuals who are able-bodied, meaning you are an adult without a dependent and you are within the ages of 18 to 64, you are required to work 20 plus hours a week, or you can do like a job training or volunteer, or you must make, I believe it's 217 or $250 weekly, and you will be meeting these ABOT requirements. But if you have a child who's under the age of 14, or if you meet any of the ABOT exemptions, like you're physically or mentally disabled, or you have a doctor's note saying like why you can't work, you could be exempt from this program. But if you do not participate in the ABOD program, you would only be eligible to CalFresh 3 months out of 3 years. And the way that Orange County Social Services Agency is assisting with individuals to meet these ABOD requirements is we're actually working with OC Workforce Solutions, where we're helping clients either do job search to look for employment, or we can help them enroll for job training programs so they can get certified and meet these requirements. And the next update is the one effective April 1st, which is next month. It's coming in a couple days, is uh, these individuals will no longer be eligible to the CalFresh program, and that's going to be the asylee seekers, the refugees, public interest parolees, battered non-citizens, or human trafficking survivors. And the individuals who are still eligible are Cuban Haitian entrants or lawful permanent residents or LPR, green card holders. The next program I will be discussing is the CalWorks program. So we talked about the CalFresh program, and that's money for food. For this program, this is money for anything else. So you can use this money for anything. You can use it for rent, or if you need like a car repair, you can use that money however you wish. It's for yours to keep because this one is actually not a loan. We have another program called General Relief, where that one is a loan, but this one you get to keep and you don't have to pay it back. And just remember with this program, you must have children under the age of 18 to be eligible. And the reason why this program exists is because we want to assist families to become self-sufficient and not rely on cash assistance from the government. Because for this program, it's only going to last you 60 months, so 5 years. And the benefit with this program is we actually offer job search programs, job training programs that are fully paid for. If you have a job, we can assist with like mileage reimbursement, childcare, and like work equipment. If you, for example, work in construction, we can actually help you pay for your tools to work. Because with this program, we just want to make sure that the child is meeting those needs and the parents are being self-sufficient enough to support their children. Because again, this program is only for 60 months. And again, your child must be under the age of 18 to be eligible. So let's say, for example, I have two children. I have a 17-and-a-half-year-old and I have a 6-year-old. Once my 17-and-a-half-year-old turns 18, he's no longer going to be eligible for CalWorks, so I will not be getting cash aid assistance for that child. But since I have my 6-year-old, I would technically still be eligible for CalWORKs and I would still be able to participate in the program. And the benefit with this program is you get enrolled into like a subcategory program called the Welfare to Work program, where you actually get assigned to a social worker and they'll pretty much guide you through the whole CalWORKs program and they'll assist you with creating a roadmap on what steps you need to take to become self-sufficient and eventually be able to support your family. And with that social worker, um, they'll also be working with you hand in hand. Like, let's say if you need like shoes for work or if you need like a suit for a job interview, we can assist with that and you would just contact them. So who may be eligible for the CalWORKs program? Well, again, you must have a child under the age of 18 and you must be a U.S. citizen or a legal resident of California. So this program, I would like to say that this is public charge. What public charge means is if you are an individual with unsatisfactory immigration status and you were to apply for this program because your child does have legal status and they're a citizen, it may or may not affect you becoming a citizen. So that's why for those individuals who do apply, we do inform them to do seek legal advice because applying for CalWORKs could potentially affect you becoming a citizen. Because with this program, you're actually getting cash. Like you can you can pull out that money and use it however you wish. And with the CalFresh program, you can only purchase food on it. Whereas with this program, you're actually getting money. So if you are um, an individual with unsatisfactory immigration status, um, do seek legal advice if you want to continue applying for the CalWORKs program because your children can still be eligible for this program. You just wouldn't get any of the services like the childcare or like those job training programs. You would only just get the funds for the child. And again, I had mentioned the Welfare to Work program. Once you enroll for CalWORKs and you're approved, you automatically have to participate in the Welfare to Work program. And this is where we assist you with looking for jobs. If you want to pursue higher education, go to college, get a degree, we can assist with that. If you need childcare, we can assist with enrolling you in childcare. It's fully paid for. Or if you want like your relative to be your child's caretaker, we can also assist with enrolling them to be a child care provider and they can actually also get paid for it. We assist with transportation, mileage, ancillary, meaning if you need additional money to like go to school to purchase school supplies, or if you need like a laptop to job search, we can assist with that as well. And the employment support services, like purchasing uniforms or work attire to participate in the job. That's what the Welfare to Work program is. And the benefit with the Welfare to Work program is this is the only program within all of SSA that offers housing assistance. So the first one is going to be the Temporary Homeless Assistance, also known as THA. And this one provides individuals with a motel voucher. So if you're an individual who just got removed from your home and you need a place to stay, we can assist with a motel voucher. It can last up to 16 days. You would first get offered the 8 week or 8 day voucher. And then after the 8 days, you would need to contact the worker again and show proof that you did stay at whatever hotel or motel that you were staying at and prove that you were also looking into homes. And then we can administer the remaining 8 days of that motel voucher. The next one is the Permanent Homeless Assistance, also known as PHA, where we assist clients who are either trying to secure a house or prevent eviction, meaning if I'm an individual, I'm about to get evicted, I can apply for this program and I can actually do 2 months of back rent, or if I'm an individual who's already homeless and I'm now trying to secure a new place to stay, I can also do the 2 months of down payment for to secure the home. And the next one is expanded temporary homeless assistance. And this one is similar to the first one, temporary homeless assistance, but with this one, this is more towards our individuals who are experiencing domestic abuse and they're trying to flee from their abusers. And if you are interested in applying to any of these three amazing programs, you can do it 4 different ways. We can do online through the Benefits Cal portal. It's super simple. You just go on this website and you can actually apply for all three at the same time if you wish to. And it takes about 30 to 45 minutes to get through the whole application. You don't have to answer every question. You just need to answer the ones with the red asterisks. And once you submit it, then a worker will contact you within 2 to 3 weeks. You can also call our SSA call center at 800-281-9799. The hours are from 7:30 to 5. Or you can go into one of our 5 office locations Monday to Friday from 8 to 5. Or you can always fax the application. And these are our 5 office locations. We have the Garden Grove Regional Center, Santa Ana, Anaheim, Laguna, and we also have our newest location, the Community Service Center over in Brea. And the benefit with all 5 of these office locations is you can go to any one of them, regardless if they're not your home office. So let's say, for example, I live near Garden Grove. My home office location would be the Garden Grove Regional Center. But let's say I'm in Santa Ana for whatever reason, I'm running like errands, and I need to see a worker. I can actually go to the Santa Ana office and speak to a worker, and I would still get the same service I would at my home office. You would just need to give them your case number and they can assist you. I would like to highlight the Brea office location. Um, I know it is one of our farther locations, but with that location, not a lot of people know about it. And if you don't want to wait 2 to 3 hours in our more popular offices, these 4, I would recommend going to the Brea office location because you'll probably wait 5 minutes to see a worker and you'll get the same service. So that's a quick tip on that one. And again, they're all open, available from 8 to 5 p.m. The next program I'll be discussing is the in-home supportive services program. So I mentioned with this program, it's a program to assist you with getting a medical care provider. So to be eligible for this program, you must have Medi-Cal. If you do not have Medi-Cal, you cannot be accepted into this program. You must also be aged, blind, or disabled, and you can also be an adult or a minor. Let's say, for example, you have a child with autism, they could potentially be eligible for in-home supportive services. And for this program, we want to make sure that you are living in your own home. We don't want you having like hospice care or going to like a care facility. That's why it's called in-home supportive services. We want to make sure that you are safe in your own home and you're still able to do the things that you wish in your own home. And the way it works is if you want to apply, we would have a social worker come into your home and we would evaluate the client. So the social worker will ask you, are you able to cook for yourself? He'll see if you could. If you can't, he'll make that note. If you're not able to get out of bed, he'll make that note too. And then once they complete the assessment, then they would determine how many hours you would be receiving by your medical doctor. And that's how long you would have that medical care provider be at your home to give you your services. And the services uh, vary. So it can be cooking or cleaning of your home or cleaning of the individual. It can also be as easy as calling the client and saying, hey, you need to take your medication at 12 o'clock. Like there are a wide variety of different services to be a care provider. Um, and if you do want to be a care provider, anyone can be a care provider. All you need to do is clear a background check and have a work authorization permit. And you would contact this telephone number below, or you would just email the registry to be a provider. But um, if you don't know anyone that needs a care provider, we do have a list as well to grab into to see if they work with the client because it's up to the client if they are comfortable with that work or that care provider. So they would interview them. They would see how their work ethic is. If they're not comfortable with them, then they would just go back to the list and select a different person to be their care provider. But anyone can be a care provider. Let's say my significant other is on IHSS. I can actually be their care provider so long as I meet those requirements of clearing the background check and having that work authorization permit. I can get paid to take care of my wife. Um, and like you're already doing it. So um, being a in-home care provider is pretty good work. And I believe the current pay rate right now is $18.75, and you can work about 260 hours included with overtime per month, and that's roughly about like $5,000. So if you are interested in being a care provider, make sure to give them a call or send them an email. And how to apply for in-home supportive services, you can either go on the website or you can email this inbox. All you need is your name, telephone number, address, and the name of the client. And then the social worker will go over to the home and evaluate the case. You can also call their telephone number. It's available from 8 to 5, or you can go to their new office location over on 2020 West Walnut Street in Santa Ana from 8 to 5. Or again, you can do fax. And that essentially is it for my presentation. We can actually open it up to the question and answer portion of the presentation.
Brian, thank you so much. This is a great meeting because you've given us a lot of information. It's very clear. And as you know, we have received a few questions before, and I would like to ask those questions. In the meantime, I invite anyone that has a new question that could just go ahead and type it in the chat, and that way we can ask Brian. The first question we receive is, can you please speak about the medical benefits for vision and how often can students or their kids can get exam and get a new set of glasses?
Yes. So with that one, you can actually refer to this website. It's from DHCS, where they pretty much explain the vision benefits. But in regards to the how often they can get the low cost or free vision services, they would need to contact Cal Optima directly or whoever their managed care plan provider is, to get those answers. But mainly, Cal Optima, if you contact their health or their main helpline number, they can assist you with how many that services. I'll actually put it in the chat as well.
Thank you. So whomever is interested about getting the answer for this question, he just put it in the chat. You can just click on that link or copy that link and save it for future reference. The second question that we received is, will my child continue to be eligible for Medi-Cal when they reach the age of 18?
Yes. So if you have a child who's under the age of 18 or they are 18, they would still continue to get Medi-Cal up until they turn 19 because that is when they are considered an adult. So up until they turn 18, they're good, but once they turn 19, then more than likely they would need their own Medi-Cal case.
Great, thank you.
Mhm.
The last question we have here is, how do we know when there's any changes in our medical plan?
Yes. So to fully determine if your child was affected to any of these changes, you would either need to contact your eligibility worker. So you would need to go into the office, or if you create your benefits Cal account, you can actually see everything that's going on with your case. So that's why we highly recommend you create a benefits Cal account and connect your case number to your account because you can actually also upload any documents you may need, like if you need to submit your child's social security number or if you need to upload your new pay stubs, you can do all of that on your benefits Cal account. You can also set up an appointment through Benefits Cal to meet with your eligibility worker. And if you were to submit any documentations, your worker actually does get notified on their end, and they'll see that you uploaded a document under your case.
Mhm. And the last question that I may have is there any information you can provide about emergency medical? Who qualifies and what are the most or the basic situations that a parent could qualify for emergency medical?
Yeah. So for the emergency services, if you do have satisfactory immigration status, um, you essentially have full scope Medi-Cal. You would be eligible to emergency services. Also, to those individuals who don't have satisfactory immigration status or who are undocked, you are still eligible to the emergency services. You're just not able to get like the other benefits like the doctor, like the regular checkup visits or like prescriptions. And from the emergency services, it's mainly for like life or death situations or it's like immediate need. Also in regards to like the other emergency services, it could be like pregnancy services. Like if you're pregnant and you need like those regular checkups, that's also covered.
Great, thank you for answering. Those are the questions that we had from our parents earlier today. Is there anyone else that would like to either type their question on the chat or would like to speak up? We can unmute if you need to speak and ask your question.
And mine says chat disabled, but maybe that's just me.
Thank you, Pam. Let me double check and see. Do you see it now?
Yes, thank you so much.
Okay, so now we can type our questions. It's very important that we have the opportunity, and thank you, Brian, for taking the time to come here. We all know that things are changing rapidly, and the information you provide today, it might change in a couple of weeks. That's why we have invited you to come to our DLAC meeting, our next DLAC in May, and we will, be able to have you for in person. And I'm pretty sure by then we will have updated information. Is that the situation that we constantly get updates on the benefits?
Yes, by May, we should more than likely receive some updates for the 2027 or the 2028 year. But for sure, right now, what we know about 2026 is the ABOD stuff for CalFresh and the individuals who did not have satisfactory immigration status, also known as CIS, are not eligible for Medi-Cal. So for 2026, these dates are confirmed, but anything past that, we're still waiting on it, but hopefully by May, we do hear something soon.
Thank you very much. Anyone has another question? Um, I'm not sure if I'm understanding. I'm receiving a text about a question, but I believe what they want to know is if for any reason will Medicare will take your from your own assets any debt or will be able to have any access to your own property? Is there a way that they could do that? I don't know if it's that the right question they're asking me, but it says like if they have any access or that you may have, Medi-Cal
Mhm.
will reach out or remove them from you or take them away.
No, so if you're referring to the asset limits,
Mhm.
so for a single individual, the asset limits, the minimum requirements is 130,000.
Oh, okay,
So
okay.
let's say, for example, I have $135,000 worth of assets. I
Mhm.
would need to spend down. So if I have 135,000, I would need to spend that 5,000 to meet that 130,000 asset limit requirement to be eligible for Medi-Cal still. But again, this mainly is affecting those older population or like the disabled population because we're also taking into account like their retirement as well. But you should be good so long because we do excuse the first home and the first car.
Oh,
And
okay.
as long as you meet the income requirements for Medi-Cal, you should be good. Because for adults, the income requirements are different. And for children, the income requirements are much higher. So there are cases where families apply for Medi-Cal, but the parents aren't eligible, but the children are. It's because those income requirements are different for children. It's higher, so the children are more than likely to receive Medi-Cal. I hope that answers the
Okay,
question.
it does. I really hope that that was the question. I think they just wanted to make sure that, let me see, I have another question. Just want to make sure anyone else that has any other question can just type it on the chat. That will be very helpful. Let's take advantage of the opportunity to have Brian here with us. It says if we apply in 2025 and we renew in 2026, um, do we get to keep the benefits
Yes,
or it's going to be changing in 2026?
you would still keep it so long as you complete the annual renewal, which is that big packet that I had mentioned every year that you need to complete. You should still continue to receive your full scope Medi-Cal because you're grandfathered in because you applied before January 1st. Mhm.
Thank you. Thank you.
Mhm.
Someone else, anyone else that wants to ask a question? Um, it's a great time to ask the question. Any other tips that you can give us, Brian, to keep up updated? Do we have a website that we can visit and find out, like, for example, if we have a special medical need, how do we find out that we qualify, or where do we go to find updated information?
To find updated information, you can always visit our website. I'll actually link it right here in the chat, but it's ssa.ocgov.com for mainly all the program updates, anything related to us. We'll always update you guys on that website. If you need assistance with like medical services, you can go on to CalOptima's website, which I believe it's like caloptima.org. But yeah, it's pretty much it. And again, if you do guys have any questions for me later that you don't know, you guys can always reach out to our inbox. It's SSA outreach inbox.ocgov.com.
Thank you, Brian. I wish we can clap you and give you the thank you because it was very clear, your information. We were all very attentive because we all benefit from these questions.
Mhm.
And the information you gave us with Medi-Cal, it makes it much clearer because we know that sometimes we are afraid to apply and we just need to be, have the knowledge to be able to apply for all these benefits. So thank you very much. Um, I would like to just share with our parents that we are having some upcoming events. I don't know if I can share my screen.
You should be able to, Miss Figueroa.
Mhm.
But if you'd like, I have the flyers up
Okay.
if you'd like me to share them.
Okay, that'll be
Sure.
great.
Let me go ahead and see
Trying to open it, but
right here. Let me see if you can see it, okay?
okay. Thank you so much. We
See.
have so much events coming up for you guys. Everything that The Family Resource Center is to provide you with materials, information, and events that are good for our family. We having the Family Naturalist Hike. That is a great opportunity to get to know our community. It's going to be on Wednesday, April 8th from 2:30 to 4:30. And this is going to be a very special way to do it. The parents and the kids are going to be meeting at the district office, and we all going to go together and have this big experience going to with the Laguna Canyon Foundation. I think Yvonne and our specialists here at the district have a great relationship with the Laguna Foundation, and they've been able to work with us and have this opportunity. As well, on April 22nd from 11:30 to 1 o'clock, we want to invite you to, we have the registration codes there to go to the seminar, the Parent Toolkit seminar. This is a great series. The next one we will be having is going to be at El Moro in the multipurpose room. If you have the opportunity to participate, they provide you with great tools that you can use at home. And it's something that our counselors at the school and Yvonne Radar have put together for families. So take advantage of this grade. And we also have the event. I don't know, Yvonne, if you have the flyer from Straining to Parenting that is coming on March 25th.
Yeah, let me go ahead and stop sharing
We
my
have
screen
a,
and I'll share another screen briefly. One
thank you.
moment.
That is going to be the third session, and it's going to be at the library. Um, we already have made groups, but anybody is welcome to participate. We constantly have new information. This time is going to be about vaping, the risk of vaping in our youth. So we know that our kids have exposed to so many things, but it's good for us to be equipped and be able to help and navigate these situations and always have the door open to ask questions. So we invite you to participate in all of these three events. And if anybody else has any other question, this is the time. Okay, here we go. Yvonne is sharing our, this is our Family Resource Center website. As you know, you're all welcome to visit it. And then we have so many update information constantly. So coming down to the three different events that are coming up this month, as I mentioned, this is what we had today, the Medi-Cal webinar. The next one, it will be this training to parenting that is going to be taking place over at the high school. These events are start at 5:30, and they always have a guest, very good guest speakers. So I invite you all to participate as well. And as I said, we have the naturalist and Yvonne, this one, the one on April 8th, that
Yes.
we're going to be meeting at the district office.
Mhm.
This is going to be for preschool students all the way to fifth graders. Do you want to give us a little bit of insight?
Absolutely. So we are teaming up, as Ms. Figueroa said, with the Laguna Canyon Foundation and the Next Nature Center. And what we're planning with our partner, Gloria Harwood, our coordinator of environmental literacy, is in taking families. So this is a family afternoon where we want you to bring your child with you and take a hike with us in the canyon, and then we're going to explore the nature center and get a full tour of the center. We're going to be guided by workers there that are going to help teach us a little bit more about the environment. But really, this is an opportunity for us to really learn about our surrounding environment here in Laguna Beach. And it's a family event. So we want you to make sure that you join us. We're going to get on a district bus from the district office over to the canyon because there is no parking available there. And every student must be accompanied by their parent or caregiver. And we encourage all families to join us from preschool to fifth grade. If you have older kiddos that are interested, please just reach out to us and we're happy to answer any additional questions for you. Because we know that families have students from elementary to middle to high school. So if you have students in that age range, just reach out to us. We're happy to accommodate as best we can.
Thank you, Yvonne. Thank you. I want to invite everyone, if they can, to open their cameras and just move our hands here to give a big clap to Brian for being here for us. We really thank you, Brian. You did an excellent job. We appreciate the time that you took, and we look forward to seeing you here back in May with our families for the DLAG group. Thank you again, and we wish all of you the best of the days, and we hope to see you soon here at the Family Resource Center. Take care. Bye-bye.
Thank you,
Bye.
everyone.